Good afternoon, and thank you to SAGES for the opportunity to speak in this forum. We don't have any financial disclosures, but all of the authors are involved in the Facebook group that is the subject of this study. So, as a surgeon preparing for an upcoming tough case, what are the resources that are available to me and maybe you to help think about all the aspects of a patient's management? I might turn to a few of my trusted textbooks. I may, like my colleague Alex presented in our first talk, go to YouTube to look at a few online videos presented at a surgical meeting like SAGES as a refresher on some of the operative pitfalls that I might encounter. I can wait a year for the next SAGES in Seattle, and I can attend talks and ask questions. But what's probably most important for me, and maybe for you too, is I'm going to talk to my mentors. I'm going to talk to my mentors in my fellowship in Seattle and get their opinions. I may call my mentors where I trained in residency at GW for their perspective. But at most, we're talking about getting the opinions of 3, maybe 4 people. But what if I had access to an even larger network of colleagues, a network that led to a map of connections and opinions and experiences that looked more like this? Today, I'd like to describe one such social media resource that provides a real-time opportunity for surgeon collaboration, education, and professional development. So we're exposed to various forms of social media today that have really revolutionized the way we communicate and socialize. Facebook is a very popular social networking platform that's being increasingly used for not only personal networking, but also professional collaboration. As a result, there's a progression of social media sites being used as resources in the medical community worldwide. This has been described in the literature, as you see here, but there really are no current studies looking at the use of Facebook communities as a tool for surgeon professional development and education. In an effort to address this rise in social media use for physicians, SAGES has established a closed Facebook group dedicated to the discussion of surgery of the esophagus, the stomach, and the small intestine, the SAGES Foregut Masters Program, formerly known as the SAGES Masters Foregut Surgery Collaboration. Membership in the group is restricted to surgeons, surgical trainees, and members of the surgical industry, and all members are vetted by the moderators of the group. The overall aim of our study was to describe how this forum is used as a tool for professional development, education, and quality improvement. So all posts added to the Foregut Forum since its creation in April 2015 until December 2016 were reviewed and categorized for content and topic. We also reviewed posts for potential identifiable patient-protected health information. Our member and post statistics were obtained from Gridix.com, which is a Facebook group analytics service. And looking at our group, so over that time period, the group accumulated 649 total members, 347 of which are active, a total of over 400 posts, and over 4,000 comments, with a median of 10 comments per post. There are over 50 topics that were discussed, and we see here just a sample of the most common topics, with bariatrics and GERD being 2 of the most popular topics. The topics were then characterized into 5 categories of patient management, operative strategy, networking, continuing education, or other. And most of the topics fell under the categories of patient management and operative strategy. There are various media types that were included in over 50% of the posts, with 44% depicting radiologic studies such as an upper GI or a CT, 13% with intraoperative photos or videos, and 8% with images of esophageal physiology studies. Oops, I'm sorry. Do you mind going back 1 slide? Thank you. 33% of these posts were included links to other pages such as YouTube, videos, journal articles, or the SAGES website. One post was identified as containing identifiable protected health information in an endoscopy report, and that was deleted once identified by the moderators of the group. So let's see an example of this. So a surgeon posts a case and asks for advice regarding his management plan. He includes endoscopy and manometry studies in his original post. And this generates 17 comments in 24 hours. The group, in their comments, they request an upper GI, and the surgeon posts it. And here we see that he posted without any identifiable patient information, and the posters can get a sense of the anatomy. Also in the comments, another surgeon posts a link to a relevant article for the group to download and read on their own. The original posting surgeon then notes the comments and then expresses that he will alter his plan for the patient by performing a repeat manometry based on the feedback. In terms of activity and engagement on the board, members are posting, reading, and interacting on the board pretty uniformly throughout the week. And there's board activity and posting 24 hours a day. The majority of our members are surgeons who are out in practice. And then looking more closely, sorry, that slide cut off, but looking more closely at practicing surgeons, private practice was nearly equal to those in academics. Private practice was 41%, and 19% of the group members were from the international community. Members are all over the United States, representing 44 states, and international, representing 40 countries spanning 6 continents worldwide. So the main limitations of this study is that this is a social media platform that's new and it's evolving technology, and it's difficult to make conclusions about the effect of this collaborative environment as it's likely to change and grow over time. By its nature, there's no comparison group, and so it's impossible to really know if the SAGES Facebook group is more or less effective than the traditional avenues for surgical education. Lastly, this analysis is subject to bias given all of the author involvement in the creation and participation in the group. The forum experience itself is subject to opinion overload, groupthink phenomenon, and the bandwagon effect. And additionally, even though patient privacy violations are rare, anything posted online is in theory discoverable, so mitigating privacy risks will continue to be a concern moving forward. So social media is a unique platform where surgeons can have real-time learning, discussion, and collaboration towards a goal of treatment, optimal treatment of surgical disease. Active online communities such as the SAGES Foregut Surgery Master's Program have the potential to enhance communication between surgeons and could serve as a potential adjunct to the traditional methods of continuing surgical education. Additionally, this represents an opportunity for surgical societies to adopt and promote professional and responsible use of social media. Lastly, SAGES is already in the forefront of developing and promoting these social media communities, as several forums similar to the foregut group are available to surgeons and could be worth adding to your pocket of resources. Thank you.
Questions from the floor? Comments? I have one quick question. Same as what we discussed before with YouTube, this is a great presentation, very well done. How do we filter experience? Because, you know, there was a student, there was 0.13% of the student comments. How do we know that how do we limit who can make comments on what to do? Because it has legal implications and you know.
Yeah, no, that's a great question. Thank you. I think from what we're seeing on the forum is that a lot of times people will give that caveat that I'm a student or I'm a resident or I'm a fellow. I have these questions, or this is my limited experience with this. So a lot of times people are putting their own qualifications on the advice or the experience that they have. And so I think continuing to encourage that is how we filter it. I think it will be difficult to say, well, if you're a student or a fellow, or you can't comment. I think it's more encouraging people to qualify what their experiences are when they're posting and discussing.
Yeah, it's a difficult topic. Okay, thank you very much.
Thank you.